Hello, I'm Maria Hall Brown, and this is LA Currents. Over 450 million people worldwide suffer from some sort of mental health issue, but there's still some sort of stigma attached to admitting that. Why? Well, we need to figure that out and we need to change it. And I'm delighted to be joined today by Dr. Kokinda from LA's Medical Services to talk about this very real problem. Why is there such a stigma about admitting that you have some sort of mental health issue that could easily or maybe difficultly addressed, but you have to face up to it first?
Well, you know, as I like to say, we all have our issues, so it's incredibly common. Everybody needs some help at times, but we don't like to ask for help. You know, people want to do things on their own and appear strong, which is understandable. However, like you said, help can really improve someone's life when we're struggling.
Then there is that whole campaign of Break the Stigma. So, you know, a lot of it is sharing your stories in order to demonstrate that you're not alone. Do you feel that that is something that is incredibly important?
Yes, especially in these current times, because one thing that I can attest to, you know, both personally and professionally, is that no matter who you are, this last year has impacted you in some kind of way that's not been the best. So we all need to focus on wellness and mental health now. So sharing our experiences will help us heal together, you know, and move forward in a positive way.
All right, I'm going to put you on the spot here because you are, you know, a psychologist. So you see people via virtual, you know, telehealth. Are you missing anything when that happens? Because we're live here together. I can see you, I can see your body language, you can see my body language. So are there things that you're worried about missing as a health professional when you're dealing with somebody during telemed? Or do you feel like you're really getting a good picture of what's going on?
You know, in the beginning, to be honest, I was really concerned that we're going to miss some of that being in the same room, because for me, I do think that's a benefit. However, what I've found to be surprising is when you're doing therapy or treatment with someone in their home and in their environment, there's benefits, like one treatment for anxiety. For someone that I was talking to, a colleague who was treating someone who had some anxiety, and part of the intervention involved moving some things around in the kitchen and they were able to do that during session, which, you know, in a therapeutic room, I might tell somebody, here's your homework, go home and work on this. But if you're on, you know, the tablet or the laptop, you can go right with that person to their kitchen, help support them through what needs to be done, and that's actually a huge benefit.
All right, so we have in our family what we call, you know, this whole time period has been a no judgment zone. That no matter how someone handles this, you can't pass judgment because you can't, you know, feel what they're feeling and you don't understand. So that's kind of one of our little coping mechanisms. What do you suggest some other coping mechanisms that anyone can do?
I've had this conversation a lot recently, and the thing that I think tops the list, besides the no judgment, that's really awesome. It's very difficult, I'm sure, at times, but you know, it's like you take that judgment and you just ride it out, you know. But the other thing is communication, because if we can understand where people are coming from, you know, that helps, or at least reaching out. Like, I just had a conversation with someone who was saying, you know, we had this big family celebration time, and, you know, my friend invited all these people. I didn't feel comfortable inviting people, so now I'm worried people think that I didn't want them there, but it wasn't because I don't want them there. It's because I'm not sure what's safe, and I wanted to err on the side of caution. So this individual is very worried about offending people, and, you know, one of the best things we can do is just reach out to the people you're worried that may have misunderstood or not been clear. So if you let them know where you're coming from and why, then at least that alleviates some of the stress from not knowing what people think your motivations were.
If I was sitting in a professional setting with you and I admitted that I was going through some sort of perhaps depression, you know, I'm feeling lethargic and I can't move and everything like that, what are some of the things that you would tell me to attempt to do? What would be some of my homework to kind of get me to determine whether I need to pursue something further or whether this is just some little tiny thing I have to go through?
So one thing is just to take an inventory of your routine. What's changed? What might you be able to add back in? And that's a good starting point to see if when you start to get back to what you used to do behaviorally as your mood changing with that.
So in regards to what's happened to all of us worldwide in the last year and a half, there is a very sensitive population who won't be able to have that self-awareness to understand what has happened to them. And you're a mom, you understand this. So what are you looking for in your little guys? Because they've gone through this too. They've gone through a period of unknown. They've seen their authority figures be a little concerned. You know, they haven't had the access to their friends the way they had before. Their life has shifted and now it's shifting again. So what are you looking for in the health of young people, and what should we be doing to assist them make it through this transition?
Very good question. So depending on the age of your children or the young people who you care for, you want to, if they're able to have a conversation, have open conversations with them. You can be direct and ask how they're doing. You can also share that you've been having a tough time, they've seen that, or they might have seen some news that was upsetting, and you can speak with them about that. It's good to be open to their developmental level. And then the younger kids, they just don't have the language to explain their feelings, so you look for behavioral shifts. If you're seeing, consistent behaviors that are not what you would expect from your kid, and it's not just a developmental thing, I have a toddler, so there's moments where she's going to act like a toddler, but then there's sometimes where I can see, oh, she must be having a bit of a tougher day because this is above and beyond the norm. So I'd want to address that then.
Sleep has been a big part of this whole thing. I mean, how many people have you talked to that are sleeping too much or can't sleep at all or up in the middle of the night? I mean, seriously, feel free to call me at 3:30 in the morning because I'm going to be up for a while. I mean, what has happened with our sleep during this thing? Is that just a natural component of stress?
It is. Also, it's just a period of change. A lot of people's schedules changed pretty suddenly. Commutes were different or non-existent, and then people had a little more flexibility in their day, and part of back to, those lazy days or that unhealthy coping where they maybe took some days and did stuff that was really just not a normal behavior for them that throws off the sleep pattern.
How much is physical activity important for mental health?
They're both so important for mental health. Your body, your mind, your emotions, they're all interconnected. And if you improve one, then everything gets better. If you let one lag or fall behind, then everything kind of falls behind with that. So that's why it's an important way to look at our wellness, as a word that I like to use, because that includes our mental state, our emotional state, our physical state.
What about just people in our peripheral world? Perhaps not somebody super close, perhaps a neighbor, perhaps a colleague, now that we might be going back into the workplace. What should we be looking for in others, and where's the line between, crossing into someone's personal space and actually giving them some advice or some help that would make a huge difference?
One thing is be mindful of how people appear. If someone just went through something, or if they're acting differently than you know them to be, you can reach out and say, hey, I'm here if you need anything, or how are you doing? And then see how they respond. If they really welcome that invitation to talk or seem to want more, then of course engage. If they say, okay, thank you, and leave it at that, then maybe give them some space, because we all cope differently. We all want different support.
How do you feel about social media and young people? Because there's actually a study saying that because the youth are growing up with this and they're able to compartmentalize it, it's like, us growing up with television or the generation before us growing up with the radio, that it's not nearly as destructive as we, as adults who may not have had that access, felt it was.
It's interesting. I think we're going to have to wait and see how that really continues to play out. It does skew some perspectives, and we have to keep an eye on it for sure, but hopefully that study's onto something.
Yeah, that would be awesome. Well, thank you so much. It's always terrific to have you with us.
Thanks so much for having me.
And that's a wrap on this LA Currents.